Israel and Australia's low COVID-19 infection numbers are getting much attention and envy from other nations around the world. With over half of the population vaccinated against the virus, the numbers indicate that Israel may soon reach herd immunity, meaning daily life is slowly edging back to normal. Australia, meanwhile, has yet to see the pace of vaccination speed up across the country, but its initial containment of community transmissions continues to keep infection numbers very low. Are these countries nearly out of the woods, or will the new variants of COVID-19 and the emergence of side effects cause changes to their plans? Today, we take an in-depth look at these two countries, and for this, we turn to Professor Nadav Davidovich, who is the Director of Ben-Gurion University's Negev Public School of Health in Israel. We also have Professor Gary Jennings, who is the Chief Medical Advisor to the Heart Foundation of Australia and Senior Director at the Baker Heart and Diabetes Institute. Very warm welcome to you both. Thank you so much for joining us. And Dr. Davidovich, if we can start with you first. Well, your country's obviously been doing extremely well. It's gaining a lot of global attention. And since you began your vaccination program, you've seen your COVID infection cases and the fatality numbers fall to very, very low levels. Do you expect this trend to continue? And how close do you think you are to reaching herd immunity?
Good morning for me and good afternoon for you. We are indeed very close to herd immunity, and probably now the indirect effect of the vaccines and the fact that almost 95% of the population over 50 and those with high risk are vaccinated is really giving us an option to back almost to normal. We have now no masks. We are now opening sports events, cultural events, also using the Green Pass, giving those who are vaccinated, recovered, and those who are doing tests to get into these events. And in general, things look much better. It's almost science fiction if we think about 3 months ago that we had maybe one of the highest cases per capita in the world. I think that what is really very frustrating that still the Palestinian Authority, we are hopefully have them also vaccinated. Otherwise, we cannot get into herd immunity because there is lots of exchange. And as you mentioned, we have now lots of energy focused on international airport because we had the cases coming, for example, from India, including students and foreign workers. And we established now a national plan for genetic typing, and so I think this would be our next challenge. But also long COVID and also the stressed healthcare workers. This is probably going to be with us in the coming months. We opened clinics for long COVID, and also we want to invest now in the public healthcare system and see also how the economy, mental health, and other issues such as educational system are going to be reformed from the things we learned, especially strengthening the local communities and the municipalities that should take a central role.
Right, so now that you're getting the numbers down to very low levels, you're starting to see things in a more holistic way and really responding to them. That's great to hear. And well, Dr. Jennings, Australia also continues to record near zero cases and fatalities every day. And it seems now there's more focus on rolling out the vaccinations, but like South Korea, those are coming along quite slowly. Do you think that countries that initially flattened the curve very quickly are still considered successful and more resilient against transmissions, or do you think they need to move a lot faster to build herd immunity?
Well, they're certainly successful in terms of having had very few deaths, and we now have no community transmission. So really the only issue for us is people coming from overseas and how they're quarantined. And that's meant there's been no great panic about vaccinating the community, although, of course, we need to get onto it. We absolutely need to make sure that that happens as quickly as possible. And one reason for that is that, to use a cliche, we're not safe until everybody's safe, and it's probably just as urgent for us to make sure that India copes with its present emergency that people get vaccinated around the world, and that this becomes a situation where opening up the borders doesn't put people at risk.
And Dr. Davidovich, now, how did Israel manage to actually procure and deliver the vaccine shots so quickly and so quickly? And there also appears to be less vaccine hesitancy compared to countries in Europe and the Asia-Pacific region. How did you manage to achieve that?
So there is not only one factor, there are several of them. First of all, vaccines are deeply embedded in Israeli culture. We see vaccination as a community factor, not just an individual choice. We secured the vaccines quite early, and actually Israel served as a model country, working especially with Pfizer. We have an excellent electronic medical record, a relatively small country. We have 4 non-profit health funds all over the country. And also, unfortunately, we're used to emergency situation. We are much better probably in having a mass vaccination campaign than, the long-term compliance. So vaccines really were in a crucial factor. Before that, we were in not such a good position. And also, we were fighting fake news. There are some communities, such as the ultra-Orthodox Jewish religious community and Arab community. There are issues about fertility and some other fake news. Again, it's really more of a minority, but we established a room where experts were searching all the social media. And also we worked with the civic society and religious leaders, community leaders. And I think this was also a very important factor. And also mobilizing especially nurses. In Israel, nurses are doing the campaign. All of this together, I think, made Israel a place where we could learn also for the benefit of the world, also giving aggregated data, not personalized data, to Pfizer and the WHO, showing the efficacy and also the safety of the vaccine. And gradually people saw the effect and became more convinced about the importance. Now we're discussing the question of vaccinating children. We're waiting for the approval of the FDA. There is no compulsion, but there are lots of incentives that are being given. And I hope that children 12 to 16 will be vaccinated in the coming weeks.
Now, Dr. Jennings, countries like Israel and the United States, they've been relying a lot on these Pfizer vaccines, but unfortunately, there have been reports of heart inflammation in people who received the Pfizer vaccine. How do you assess the situation as a heart specialist, and do you think there could be a correlation?
I think it's not clear at all yet. As of yesterday, there were 62 cases of heart inflammation or myocarditis, as we call it, reported from Israel, and a small number reported from the US military. Now, these conditions, inflammatory conditions of the heart, are bubbling along in the community anyway. And given that, 130 million almost people have received the Pfizer vaccine around the world, you would expect some of them to have heart inflammation. Myocarditis is something which has variable presentation. Sometimes it's completely without symptoms. People don't even know they've had it and they get over it. Other times people do get heart failure and serious consequences and need to go to hospital. And I think because of that, that makes it even more difficult for us to work out what the relationship, if any, to the Pfizer vaccine might be. And I think we've just got to remember that myocarditis is much more common in people with COVID than it is with people that have received any of the vaccines. And the benefit of the vaccine, this one and all of the other vaccines, completely outweighs the risks that are associated with it that have been observed so far.
Dr. Davidovich, now we've heard that Israeli authorities are looking into this and they're monitoring the situation, but would this possibly require change to your vaccination program if there does turn out to be some sort of link?
So we're still looking, this is under investigation, but I totally agree with Professor Jennings. It seems right now that it's a transient effect. Also, probably the risk is not higher than in normal years, and probably being infected with COVID-19, probably it's a much, much higher risk. So, of course, any pharmaceutical, including vaccines, always there's a risk of some side effects. But I think overall, as it looks now, it's still quite rare. By the way, it's the higher risk in the younger population, and it's mainly transient. The report is going to be issued very soon, but according to the interim report, probably I don't think this is going to influence the vaccination campaign. There were other risks such as allergies, some neurological effect, but again, if you tell me a year ago that we have such a vaccine with this efficacy and side effects that are relatively low, and again, so efficient also on the population level, I'd say that, wow, this is amazing. And I think the messenger RNA technology is really going to give us other vaccines, maybe also cancer treatment, and I think it's a great breakthrough. And we are very, very happy to have Israel now with such high vaccination rates. And most people are very happy. There's a small minority, again, that are anti-vaxxers, but compared to other countries, this is relatively marginal.
Well, Dr. Jennings, well, unfortunately, our countries in the Asia Pacific, there are substantially high levels of vaccine hesitancy in some of the countries in this region. And well, what do you hope to see in terms of getting these people to really come on board with the vaccination program? How do you think countries like South Korea and Australia, Japan, these East Asian countries and those in the Pacific can really overcome this fear of these side effects and really get the jab to protect not just themselves, but everybody?
Well, I think you're right in using the term hesitancy, because there's a very small core of anti-vaxxers who won't take it under any condition, and that's a belief, and you probably can't convince them, unfortunately. I think the answer for the rest of the population is transparency, actually, is telling people what their where they stand as far as their own risks are concerned, and making sure that information is made available to them that really allows them and their doctors and policymakers to be guided by the facts rather than what might be buzzing around in social media or elsewhere.
Exactly. So just getting those facts straight, that's really what the public wants to see, I suppose. And well, Dr. Davidovich, well, there are now new cases of the Indian variant. They were detected in Israel last week among people arriving from abroad. How are authorities responding or planning to respond to this? Do you think this is going to affect your vaccination program at all? Are you going to have to extend your lockdowns or any of your current arrangements due to the emergence of these new variants?
So we had during the last few days many intensive discussions within the expert committee of the Ministry of Health. Indeed, the different variants are now probably the threat everywhere. This time you're talking about India. By the way, I think it's a humanitarian catastrophe. And this is what we were fearing, that the vaccination campaigns, the gaps in them and the vaccine nationalism, this is finally what is happening when countries like Israel have very high rates and others less. And again, the Palestinian Authority next to Israel, it's not our responsibility to help them, but also Israel interest. Within Israel, things are moving forward. The main efforts are towards those who are coming into Israel. Now, foreigners are not allowed unless there is a specific special situation. And again, we established a whole national chain of checking, doing the genetic typing, doing contact tracing, very aggressive contact tracing, finally after so many months, and now that we have less number of cases. And when people are coming here, they need to check before, and when they are coming, and also those for coming from countries that are on high alert, like India, but there are also others, they need to be in isolation. We're really hoping that this is not going to threaten all of our vaccination campaign. Until now, all different strains, all different variants of concern, vaccines were quite efficient, even if a bit less so like the South African variant. So within Israel, things are opening, but more stringent at the borders. So that's the message right now.
Well, I'm afraid this is all we have time for today, so this is where we'll end the interview. That was Professor Nadav Davidovich, Director of Ben-Gurion University of Negev Public School of Health, and Professor Gary Jennings, Chief Medical Advisor to the Heart Foundation of Australia. Thank you both so much for your time.
Thank you.
And to our viewers, as always, thank you very much for watching.